Hi, Alison.
Hello, thanks for having me.
Thank you so much for being with us. So your work is incredibly relevant to the theme of well-being that we're discussing today. And you were even involved in one of our exhibits, Training Ground, which was part of our hedonism exhibition. So can you tell us a bit more about that, how that came about and your role at UniSA?
Yeah, so in terms of, are you interested in how I got into the area or more the training ground exhibit? So I just want to
That's okay. Maybe if we start with Training Ground and your role at
Yeah, sure.
UniSA, and then we can, go into your
So
exhibit.
training ground was an exhibit at Maud for about 4 to 6 months last year, where participants were able to engage in physical activity in sort of a competitive way. And so there was a game, it was a little bit of gamification, but they had to compete with other people. And so I got involved in that as one of the research consultants around designing that exhibit because of my interest in group dynamics and how we know the research that I do and that others do shows that when you participate in physical activity with other people, there's beneficial outcomes. You enjoy it more, or in some instances, you enjoy it more. You're more likely to continue participating. And so that's how we kind of came together and developed that training ground exhibit. In terms of my role at UniSA, so I teach in the area of health, exercise, and sports psychology. So there's one main course that I coordinate. It's within this, now the Allied Health and Human Performance academic unit. And so I teach students that are going through to become phys ed teachers, to become personal trainers, exercise scientists, clinical exercise physiologists, as well as psychology students. So it's quite broad in terms of the students that I teach, but I'm also the program director of exercise and sports science. So I sort of manage the exercise and sports science suite of courses and programs for students interested in working in the exercise and sport industry.
That's a lot. You're involved in a lot.
It keeps me busy, yeah.
Just a little bit. So it's quite, we were saying in the green room that the training ground exhibit actually got the moderators probably more fit and healthy, because every time there was a down moment, we would all jump on there and kind of, get pumping, get our blood pumping. And even the most physically inept of us really enjoyed it. So,
and it was fun. That was the whole point,
fun.
was to make it fun, because a lot of the research out there and research that I've done shows people are not going to be physically active if it's not fun. They're not going to keep doing it if it's not fun. And that's not just physical activity, that's any behavior. You're less likely to do it if it's not something you enjoy. So we want to look at how we can make physical activity more enjoyable so that people keep being physically active.
Yeah, well, it definitely worked for us.
I'm glad.
And going back to what sparked your interest in this subject matter, why did you decide to follow down this path?
Yeah, it's a long-winded story, but I'll make it quick. So originally I wanted to be a high school phys ed teacher, as lots of students do when they come into a human movement or exercise science program. And it was so in Canada, most degrees are 4 years long. So I was doing the Bachelor of Human Kinetics. It was a 4-year program. And in my 4th year, I started doing research in sports psychology, just as an extra course. And that's what sparked my interest, was actually engaging in the research. I realized, I actually really like this. Now, I was already taking psychology courses on the side, but not sports psychology. So once I got into that field, I really enjoyed it. And then I did a master's in sports psychology. And then I went, okay, well, I'll go on and do a Ph.D. So it's just kind of, grown. I knew I was in the right field with human movement, human kinetics, because I love exercise, I love sport. So my career kind of came from the experiences that I engaged in through uni.
That wasn't as long as you made that out to be.
No,
I was like ready for the
story. It can be a really long story.
Right. And so what have you explored with regards to your health behaviour decisions? So you're into social influence and messaging influence around that.
Yeah, so the overarching area that I research is how the people around you, so your social environment, how they can impact your behavior, as well as how you can impact others. So it's kind of that reciprocal relationship. So that's really important. I look at that in exercise and sport settings. More specifically, I've kind of got this niche where I look at how messages about other people's behavior, so messages about how, the prevalence of physical activity within Australia, how that impacts individuals, not only their actual engagement in physical activity, but their cognitions around it in terms of their intentions, their confidence to be active, as well as their enjoyment and satisfaction and things like that.
For sure, it sounds amazing, and yeah, like a really interesting niche area of the field. What do you find is most challenging in the research and then kind of implementation or education around in this area?
Yeah, so one of the challenges I find is there actually is a lot of research out there on messaging in physical activity. The research shows that we should be messaging the health benefits of physical activity, not the, ill effects of not being active, and things like that. So there is this large body of literature out there, but very little of it looking at social messages specifically, even though the social messages are out there. So how often on the news or in newspaper articles do you read that Australians are not very active? So I'm just throwing a number, but 15% of Australian adults meet the recommended guidelines. And so it's difficult because we actually don't know the effects of that number, giving that number on individuals' behavior. So that's what I'm trying to research, and we're starting to get some data on that, but it's just been hard to just to get collaborators interested in the area. I think it's super cool, and I think it's valuable, but also the effect of how many people is my research going to affect is we're not really sure. And so, it's difficult to, determine what the impact of my research is going to be at this early stage. It's still quite early. The research is, it's been around for 10 years, but that's still quite early.
Yeah, it sounds like it's early, but it's an exciting position to be in, to sort of, this new area and new focus. And I guess I totally understand that it's hard to kind of sell the idea to universities and to possible participants when you just need it to run for a while to get that data back.
And one of the issues we have is sometimes I have to create messages that aren't true just to test the effects of them. And so we do have an issue in terms of deceiving participants. So I occasionally, we always debrief participants at the end, saying, these messages were actually fictitious. We just wanted to see the effects of them on your cognitions. And so I'll occasionally get emails from participants, asking or just commenting on, oh, I didn't think that's what it was. And so it's nothing bad. I never, it wouldn't get through ethics approval if it was harmful to participants. So there's nothing harmful to it. But it is a consideration I have to think about when I'm developing the interventions or the messages I'm going to be testing.
Yeah, for sure. Yeah, it sounds like a really exciting time. And but these difficulties, I guess there are difficulties that that individuals come up against in sort of accessing or taking on these messages. I think a few years ago I saw a TV commercial and seemed like a positive message. It was sort of, even when you're 50 years old, you can still kind of walk back your health, and you can still get back your health starting positive action from 50 years old. And so one way I looked at that at the time, kind of maybe a bit cheeky, a bit lazy, but I'm like, oh, great. I can just wait till I'm 50 then, and then I'll start the work. So yeah, I guess, are there things that people come up against
Yeah.
or maybe misunderstand the messaging?
Well, and that's the issue too, is the target audience. So you have to think about that message was not targeted towards you. So it had unintended consequences potentially for, individuals who are under 50 years of age. But if you were a 50-plus-year-old looking at that, you might think, oh, it's not too late. So that's the message I hear when I heard that. It's not too late. You can still have a healthy life. You can start exercising now. So really, that is, I guess, one of the barriers, is that messaging. You have to know your audience, and it's very hard to develop a message that will be relevant to everyone. I actually don't think that's possible. So you really have to make it clear who you're targeting. So that message, said 50, so it's clear who the target audience is, or somewhat clear. So that's, it is, you need to know who your audience is, what the actual behavior is. So you really have to define the behavior really well in messaging, and what you want, or how you want to empower people to change their behavior based on the message that you're providing.
Yeah, for sure. It sounds like a really targeted message, and then really getting to that audience.
Yeah.
And yeah. Oh, great. It sounds really exciting.
Yeah.
It does make it hard though, to make it a population level type intervention. So, if you look at health messaging around drink driving or distracted driving, those are generally, they can be done they are done at the population level. I would love to get to that in terms of my, health messaging and social messaging interventions and messages that I create. So my ultimate goal is to work with government agencies to develop 30-minute commercials promoting physical activity, and including that social aspect in a positive way. So we want to stop telling people that Australians are not active enough, because is that going to motivate anyone to go out and be active? We can't.
Yeah,
but then we also can't tell people that everyone's active, because no one's going to believe that. So it's this balance of creating a believable message, but not deterring them by saying nobody's being active. So if you're not active, you're in the norm. Why would I change my behavior?
Yeah. You definitely can't shame people into living a more healthy lifestyle.
And that's done a lot with smoking. So if you look at, we call them fear appeals, where you're basically scaring people into trying to scare people into quitting smoking. So even the labels on smoking packages with the pictures, and here's the outcome if you continue smoking, there's research that shows it does work to some extent, but not because people just ignore those fear appeals.
Yeah, I think I maybe I've just heard it anecdotally, but it could be research based that yeah, kind of positive messaging does have more of an effect than kind of negative and fear based messaging. Do you have any information to back that up, or otherwise?
Yeah, so it depends on the behavior. Again, so target audience behavior. So physical activity, definitely the positive is better. But other behaviors like vaccinations, so some of those so they're health promotion, but they're preventing illness, basically, behaviors. So there's a bit of a difference between them. So preventative behaviors are still effective with that fear-based appeal, but promotion or positive inspirational ones are as well. So it depends on the behavior. Physical activity, they have shown that the positive inspirational messaging is better and more effective.
And so what do you hope people will take away from the work that you are doing?
So my take-home message in most presentations that I give, I like to end off by saying that it's important who you surround yourself with, because if you surround yourself with healthy, positive people, you're more likely to be healthy and positive, and to realize the influence you have on the people around you. So your behavior is going to impact the people around you as well.
Yeah, and that's a strong message for all of the healthy lifestyle habits. So yeah, it's such a good message to get out there.
Mm-hmm.
And so what should people be focusing on for a better well-being? Like especially at this point in time, like I know that my health has suffered because I can sit on the couch or I can sit in my study and do my work. So what should people be focusing on right now for a better well-being or working?
Yeah, and I think, COVID has had a really interesting impact on well-being. We've seen physical activity, obviously, levels decline, sport participation decline, which has impacted individuals' mental health negatively. Not in all cases, and not severely necessarily, but there has been a negative impact. And so now that things are returning to somewhat normal, I definitely encourage people to get out, be active, however they can and however they feel safe. So outdoors is definitely the safest. I know it's a bit cold, but I'm from Canada, so this is nothing. Get out there, be active how you can. Include other people. So instead of going for a coffee where you sit down, take a coffee and go for a walk, or go for a hike. South Australia, I know this is probably going larger than that, but South Australia has some amazing hikes that are secluded. And, I did quite a few during COVID that I didn't even know existed. Definitely another key is to break up your sitting time. So if you are working from home and you aren't getting that normal up and down at work as you normally would, just break it up. Every 30 minutes, 60 minutes, get up, do some stretching, walk down the hall, whatever it is. And for me, a big thing, the hardest thing was social for me, lack of social interactions.
Yeah.
Being a group dynamics researcher and social influence researcher, I really struggled with that. So, everyone's going to have a different level of comfort with seeing friends and people right now, but do what you feel comfortable. And if you don't feel comfortable seeing people face to face, get on those Zoom calls, FaceTime, do as much social as you feel comfortable. Just make sure you're talking to your friends and staying connected with family. The hardest for me has been, obviously I'm from Canada. I was supposed to go to Canada in June. That got canceled. So I'm doing heaps of FaceTime calls back home. And, my partner has family in Victoria. Obviously, we can't go see them right now. So it's been really difficult but we just are doing lots of Zoom calls, FaceTimes, whatever we can to keep that social connection. Social connection is so important to our well-being, as well as physical activity. So if you can combine the two, that's great. But if you can't, make sure you're, connecting both physically and socially with other people.
That's a really good point, because we've just had a question from the audience come through that says, exercise social media apps like Strava an example of motivating social messaging between friends?
Yeah, so there is some research that some colleagues have done here at UniSA looking at social media apps, whether it's through Facebook or things like Strava or, your Apple Watch, things like that, where if you see that your friends are out being active, they've logged it or they've shared it, that actually motivates you to go be active as well. There are, some negatives to it. It might make you feel guilty if you're not being active, but generally, there is a case where it's supportive. So it's basically a supportive network to encourage you to be more active.
Yeah, and I think that's definitely what I use my Fitbit for. It's like someone constantly telling me I haven't moved enough. So it's like, yes, okay, all right, I don't want to disappoint you.
Yeah, and especially the ones that you can have. So if you have an activity tracker that vibrates or tells you when you haven't been active enough. So the Fitbit I had didn't, vibrate, but it had like red dots, the red lines saying you haven't been active, and all of a sudden it's been 2 hours and you've got like 10 red lines and you're like, oh no, gotta go do 250 steps to get this down.
Yeah.
So yeah, those are definitely beneficial. And they're prompts. They prompt you to break up your sitting time or go be active to reach your 10,000 steps or whatever your goal is.
Yeah, definitely. It works for me. And have you discovered anything lately that has inspired you or even challenged your thinking in this field? Because it's been a bit of a strange year. So
yeah, it has been a massively strange year. I think what's really inspired me is the community level behavior change interventions that have happened, that individuals in Australia have adhered to, but in other countries not so much. So it's really, I think for me, what's been really interesting is seeing the cultural differences between adhering to government guidelines of social distancing, washing, hand hygiene, not touching your face, mask wearing, whatever it is. Really, really interesting to see how well Australians have done in terms of following those guidelines. And then you see other countries who aren't doing so well in following the guidelines. And obviously that's impacting the illness spreading. So I think I'd like to look more at that community level and the decisions that went behind in not enforcing, but suggesting those behavior changes and change, I should say, and really what motivated people to adhere to them. I'm really interested in what motivated people to adhere to them versus not adhere to them. And I have a big sense and idea that it has to do with what everybody else was doing. If everybody else was following them, then most people, others are likely to follow. So we see in places like the US, most people aren't following them. I shouldn't say most. There's a large majority that aren't. And so there's more complacency.
Yeah, it's been really stark seeing the difference in behaviors at this time, and then seeing those correlations with the results and the effect of the virus through communities. And yeah, I think it will be really interesting to look back in a safer time, have time to look back on what were the effects of that. And I'm sure that the messaging, whether it's just visual messaging of seeing people participate, or whether how the messages have been communicated, that will be interesting to study, I think.
Yeah, and you see different messages. So I love the government messages that came out when they were, describing what, distancing measures or, what we should be following. And they were trying to empower individuals. I felt, that's my perspective, that they were trying to empower individuals. But then you saw the news, and there would always be instances where they show, people not adhering. And so you're getting different messages. And so to me, that's also really interesting. When there's contrasting messages, how does that impact individuals' thoughts, feelings, behaviors?
Yeah, I think one of my favorite messages I saw was, I think it was in one of the national parks near the city here, going for a walk, and it had the sign was, it must be one adult kangaroo apart.
Yes.
Yeah, and that was when I was there, and because I still had phone reception there, I actually combined a little bit of outdoor exercise, just walking in nature, and also contacting someone socially who I can't at the moment because they're overseas. So yeah, so it was nice kind of combining all those things.
So I love that message. In Canada, they have a hockey stick. So a hockey stick is how far you should stay away from each other. And so I sent the picture of the kangaroo, and then I got sent back the hockey stick one. And it's like, oh, cultures. We just know based on different cultures how far to stay away from each other, depending on, what's of interest or, within your country.
And now Canadians have a reference of how big an adult kangaroo is, and we know Australians have a reference of how big a hockey stick
Yep,
is. So that's good
1.5
too.
meters. 1.5 meters.
So I know this is I'm sure that this situation right now is taking up a lot of your time and your thought. But is there anything else you're working on in this space, or something you were working on that you're hoping to get back to?
Yeah, so actually some of my upcoming research is going to look at the benefits or the effects of walking sport on older adults' psychosocial well-being. So right now across Australia, there are walking football, or I should say walking soccer leagues across Australia for older adults, 55 plus. And so there's been some research looking at the physiological effects in terms of heart rate, energy expenditure, things like that. But I'm more interested in the social connections, the psychosocial well-being, mental health effects, things like that. So hoping to get that started when they resume post-COVID.
Yeah, so for sure. Wow.
Some have started already, but yeah.
I've got that to look forward to once I turn 50 as
well.
Yeah,
there you go. So just don't do anything until 55. No, I'm just kidding. I would never suggest that.
And is there, this might just be opening a total can of worms towards the end of the interview, but what is the big question that everyone would like answered in this field, do you think, or that you'd like answered?
How do we get people to be physically active? No, I think that's a very loaded question. I personally like to look at how we can engage or use our social environment to enhance and increase individuals' physical activity. But the overarching question within the field is, how do we get people to adhere past, because if you sign up to a program, you're likely to drop out within the first 3 months. But if you last past the 3 months, you're more likely to adhere. And the biggest thing that I always suggest to participants or to individuals is when they say, oh, I don't like exercise, I don't like, sport, whatever it is. And I just say, just do something you enjoy. Walking is exercise. If that's what you enjoy, that's fine. So just, it's all about the enjoyment fun factor. If you like it, and I said this earlier, if you like it, you're more likely to continue doing it.
I feel like if we can find our own motivations and what we like doing, then that question just to ask ourselves individually as well is just really important, and will probably help your research as well, which we do. Now, I'm so sorry that we have to wrap this up, because it's such an interesting subject matter. It's definitely at the forefront of my mind during this as well, because I'm usually quite an active person. But if people are interested in finding out more, where would you suggest that we look?
So that's very interesting. There's lots of blogs and things out there that you can find. Probably it's to actually find research that's hard for the general population to get access to, unfortunately. And sometimes there's lots of jargon, academic jargon, so it's hard. So as researchers, we do our best to get our information out there, whether it's through blogs, articles like The Conversation. So The Conversation is a really great online kind of newspaper that sends out daily articles from researchers that are meant for the general population to understand. So that's probably one of your best bets. If you have any actual questions about my research, I'm happy for you to just email me. So that's alyson.crozier@unisa.edu.au. I'm sure that can be sent out. But otherwise, it's really just doing your research and making sure it's from legitimate sources. That's the key. So make sure it's written by someone who has experience in the field, who does research in the field, and it's not just some person off the street.
Oh, that's great. That's great advice. And thanks for your candor today. Thank you so much for joining us, Alyson. We've really appreciated you coming on the program today.
No problem. Thanks, Sam and Lee. Bye.
Thanks, Alyson.